The major analytes which can be of interest in fibrinolysis are triggers of fibrinolysis, TPA and UPA, inhibitors of fibrinolysis such as PI1, PI2, and the matrix metalproteinase inhibitors. And we can have some proteins which are present at a more constant concentration in blood, such as plasminogen, TAFI, alpha-2 antiplasmin, and so on. I would like to focus more on proteins which are at variable concentrations in plasma and which can be released upon stimulus or upon inflammation, such as TPA, UPA, PI1, and some complexes between these proteins, and I consider these proteins as markers. And they are of major interest because fibrinolysis occurs in the micro environment where it must be at. And the major regulatory proteins of fibrinolysis are generated in the microenvironment where stimulus occurs. When there is some endothelial stimulation, for example, because there is a blood clot, TPA is released in the vicinity and then can bind on clot. And it can be here present at several orders of magnitude, higher concentration than in blood circulation. The same for PI1, but for PI1, it is released from endothelial cells, but it can also be present in plasma in the active form, not only in platelets where it is latent, but in plasma for which the major source is liver. And this PI1 is active in a large extent. So TPA can be regulated by PI1 released by endothelial cells, and if some TPA is released in blood circulation, so it meets PI1, which is usually in excess, and it is very rapidly inhibited. So when we measure TPA and PI1 in plasma, they can also give us a good indication on some disease activity somewhere in the body. Along with PI1 and TPA, we can also have some complex forms such as TPA PI1 complexes and UPA PI1 complexes. So these markers, TPA and PI1, can be also of high usefulness for other applications different from regulation of homeostasis. For example, in brain function, where TPA can be beneficial or harmful according to the context. It can be beneficial because it helps fighting against stroke. But it can be harmful because if there is an excess of TPA, then this TPA can activate fibrinolysis extravascularly, generate plasmin, and then contribute to matrix degradation. It is what I call the yin and yang effect of TPA and brain. And this slide also shows the two roles of fibrinolysis, intravascular and extravascular, with the involvement of matrix metalloproteinase and their inhibitors. So the clinical applications of PI1 can be observed in many different clinical contexts, such as the metabolic syndrome, where high levels of TPA and PI1 can be of bad prognosis for the evolution to type 2 diabetes. They can also be useful in type 2 diabetes when it is established for diagnosing as a diagnostic help for severity of disease or for efficacy of therapies used for controlling progression and evolution of this disease. They can have also a predictivity value for heart disease, especially for TPA and mainly for PI. Recent studies show that TPA can have a very useful predictive value for occurrence of heart disease. And in malignancy, as it was also present in association with UPA and UPAR, it can also be useful, especially in tumor exudates. So, in conclusion, among the conventional blood activation markers, which are mainly plasmatic, only didarimer up to date has met routine clinical applications. However, most of the others remain definitely useful as surrogate endpoints for clinical and epidemiological studies and for validation new drugs. Emerging new blood activation markers become available, and they offer new possibilities for testing any involvement of blood and endothelial cells in this blood activation at the very early stage. And especially the assay of microparticles in plasma is becoming very useful for many clinical applications, and more especially because of its long half-life. Other markers allow exploring stimulation of fibrinolysis, especially for their application in cardiovascular disease, diagnosis and analysis of recurrence risk, or diagnosing some underlying disease or clinical applications. For example, when some autoantibodies are present or when drug-induced antibodies are present. And you know that, for example, when HYPHEN antibodies are generated, there are very huge amounts of microparticles, as it was demonstrated about 10 years ago by Varkantin Group in Canada and one of his fellows, Dr. Lee. Thank you very much for your attention.